Thank you all for taking the time to attend our NCLEX-RN session today. I'm Natasha Blugis. I am the Director of Higher Educational and Graduate Partnerships here at the Princeton Review. And today, Jennifer Cipriano, who is our NCLEX instructor, as well as part of our content and development team, will be here today to present in detail the development of our 3 NCLEX-RN programs. If you have any questions, please submit all questions through the Q&A chat, and Jennifer and I will leave 15 minutes at the end to answer any questions that you submit and any other outstanding questions. If you miss any information today, or if you'd like to pass the recording on to a colleague, we will also be sending out the recording of this session within 24 hours after it's completed. So without further ado, Jennifer, take it away.
Thank you, Natasha, just for the kind introduction. I just want to start out by saying hello and welcome to everyone on the webinar today, and just extend a sincere thank you for your participation. I'm excited to be here today to share more about the NCLEX-RN products that are currently available through the Princeton Review. As Natasha mentioned, I am currently a content developer for the NCLEX prep material at the Princeton Review. I also teach in an undergraduate nursing program as an instructor of nursing in a BSN program. And I've also had background in professional development for a large hospital system. So I'm excited because I understand that there are educators here today within the academic and professional development setting, as well as leadership. So I'm really excited to be able to present this information to you. So by the end of the presentation, really our hope is that you gain a clear understanding of the NCLEX products offered, and also how they might be incorporated into your institution for your students or your employees. We can go to the next slide. So why the Princeton Review for NCLEX-RN Prep? The Princeton Review has experienced instructors and content developers, and we'll talk a little bit more about this when we break down the featured products that we'll discuss today. So all of our content and our questions have been developed by nurse educators who are currently teaching. There are also over 1,900 questions within our QBank, or our question bank, which we'll talk about as well, that are directly from the National Council of State Boards of Nursing. So as we all know, the NCSBN writes the NCLEX, develops the NCLEX. So really, really valuable to have those questions. The Princeton Review also offers a self-paced course, which is formally known as the Learning Extension course from the NCSBN, and we'll talk in detail about that program as well. So let's dive deeper into some of these offerings and look at our featured products that we'll discuss today. Next slide, please. So these are the 3 featured products that are really our products for NCLEX Prep through the Princeton Review. So the first is our QBank, and that just stands for question bank. This is a question bank with over 3,700 practice questions, including NGN items. So we'll talk in detail about that first. Second, we have our self-paced course, which is, as previously mentioned, that learning extension course from the NCSBN that offers comprehensive content review, and it includes the entire QBank as well. And then finally, we'll talk about a product called our LiveOnline. And essentially what this is it's 18 hours of expert live instruction with a nurse educator. So that's really exciting for candidates to be able to have that one-on-one instruction. We'll talk in detail about that product as well. Next slide, please. We'll start with the QBank, which is our question bank, and we can go ahead and go to the next slide as well. So just to break down what is within our QBank. So we have over 3,700 plus drills questions written in NCLEX style form. I just want to mention the QBank first launched in the fall of 2021, and it has grown significantly since, and it continues to grow. Of those 3,700 questions, we have over 3,000 that are first generation NCLEX questions, including that 1,900 plus purchased from the NCSBN's learning extension. The additional questions were built in-house by nurse educators, and we'll talk about their credentials on the next slide, but they continue to be built day to day. We are adding questions. Within the 3,700, there are 200 plus next generation NCLEX style questions, with a plan to add over 500 additional questions by the end of this year. So we are hard at work putting together this question bank, and it's a very diverse group of content developers, and I'll talk about that on the next slide. We can go ahead and advance the slide. So all of these questions, the 3,700 plus, were written by nurse educators. And so our content development team for creating these questions either hold a doctorate or a master's in education and currently teach in the classroom. Our content development team is also currently practicing at the bedside, either on the side practicing in their own current practice as a bedside nurse or an advanced practice nurse. Also, our content development team teaches in the lab setting and or the clinical setting as well. So our team is made up of subject matter experts, and I think that this is just really important. Some of the examples here are critical care, pediatrics, maternal, newborn, and community health. And all of our content development team hold certifications in specialty areas as well. So I'll just use myself as an example because I was on the content development team for our NGN questions. And so my background is in critical care and acute care, and I teach that content within my undergraduate role, also holding certifications in those content areas. So what's nice is I would never be asked to come up with a question on maternal newborn, nor would I ever feel comfortable. And so I think that that's what's really nice about our nurse educator content development team is we all bring something to the table out of our specialty roles and our specialty areas, and we're able to write current evidence-based practice questions using those activity statements from the NCLEX and using those client need categories. And we'll talk more about that in just a moment. Another thing I want to highlight here is all of our nurse educators, as we're putting together these questions, we're also putting together full rationales for these questions that are available to our candidates as they're going through and actually doing these questions. And so all of these rationales are fully supported with current evidence. And so I just want to make mention of that as well. So we can go to the next slide. So this is a closer look at the QBank, and this is just a screenshot. So I hope that this isn't too much of the technical side, but I really wanted to give everyone just a moment to kind of see it. That's how my brain works. I want to see the structure, how this all kind of comes together. So we're going to take a closer look at the QBank in just a moment, but here's an example of the dashboard. And so you can see it includes a welcome. It's got a breakdown of the client need categories for our candidates, explaining how to use the test bank, as well as that user-friendly, I think, navigation dashboard at the top. And this allows them to access practice tests as well as the coursework, which are the questions within each client need category. So we'll take a look at both of these tabs. We can go to the next slide. So this is our practice test section within the QBank. And so the QBank includes 2 NCLEX-RN style self-assessment practice exams. So there's a practice A and a practice B. So it's sort of how I see this working in maybe a senior seminar class or in a nurse residency program, is this could be assigned for participants to complete that practice A prior to starting the QBank questions. And then once they're done with the questions, being able to go in and do that practice B to see how they've improved, their areas for improvement that they still have, and have that evaluative measure. Each of these tests are 145 questions, and they include NGN items, which is really nice. So 15 NGN items within each practice exam. The other nice thing is there are full score reports available, and I've got an example of that on the next slide that we'll go to in just a moment. But again, this is an opportunity for participants to be able to assess their areas for improvement and really tailor their practice towards their results. So we can go ahead and go to the next slide. So here's an example of the full score report. So you can see it includes the number of questions in each category, as well as correct and incorrect answers within each category or client need category. The practice indicator within the score report also reflects the areas that the learner should continue to work on. So that report will tell them they need to go back and remediate in certain areas. What's nice about this is this report is downloadable and easily accessed within the dashboard. So this is something as you're thinking about assigning to students, this could be uploaded into your learning management system. So they could download this score report and upload it for you. So you're able to see where their areas of improvement are or where their strengths are. We can go to the next slide. So on the coursework tab, so this is really the meat and potatoes of the QBank. This is where we have all of our client need categories. You can see all 8 of them over to the left, starting with safety and infection control. What I've highlighted today, I've just picked the pharmacologic and parenteral therapies, but you can see that this is all organized by client need category. So Each client need category, as we know, has a specific activity statement that focuses on the knowledge and the skills and really the abilities that are expected of our new graduates to be able to perform safely and really have competent care. So each question within this QBank, again, was developed by our nurse educator team using those activity statements as a guide, and we're going right off of the NCLEX test plan. So that's just to highlight some of the information that is currently available through the QBank. So as you can see, there's different drills here, and you can see 1 through 8 in this screenshot, but they're essentially sets of questions that the participant can work through in that client need category. And so they're able to not have to sit for 200 questions at a time, but they're broken into about 20 to 50 questions each. So they can have that, that practice and be able to move on to another client need category. We can go to the next slide. Another really nice added feature about the QBank is that they're able to study on the go. So this is downloadable through the Apple App Store as well as Google Play. And so all of these 3,700 plus questions, including the NGN items, are all available through the mobile apps, which is really great for learners to be able to study on the go. So we can go to the next slide. So let's go ahead and talk through the self-paced course. And I just want to make mention that everything that we just covered within the QBank is included in the self-paced course as well. So now we're sort of building upon what we've covered so far. We can go to the next slide. So we'll see some screenshots in just a moment of what the inside of the self-paced course looks like. But just as I previously mentioned, the NCLEX-RN Self-Paced course was originally acquired by the NCSBN in the spring of 2023. And this entire course launched with the Next Gen NCLEX this past April. So it's formerly known as the Learning Extension course through NCSBN. And really what it does is it takes a deeper dive through the content in each client need category. This self-paced course really complements the LiveOnline, which we'll talk about next. So these products are sort of building upon each other, but we'll talk about sort of some of the inside of this course as we go through these slides. So again, this is a comprehensive content review. Everything that we just discussed within the QBank, those 3,700 plus drills questions are included within the self-paced course, including the NGN items, including the full rationales, including those 2 self-assessment exams as well, which we just discussed. Another added feature within the self-paced course is flashcards. And so this is really neat because users are able to go in, really look at some of their areas for improvement and be able to make flashcards on their own. So they're then writing, and we know that that will further reinforce their learning. And then they have access to be able to go through these flashcards really anywhere. The flashcards are available on the Study on the Go as well through the app. We can go to the next slide. So just to kind of see it, this is what the dashboard looks like for the self-paced course. And so you can see it includes an intro to the course as well as a user-friendly navigation dashboard to access course materials with ease. We're going to look at more of the products within this course and just some ideas of how this might be assigned within your institutions if you choose to use it. We can go to the next slide. So we can see at the top of the slide, we have highlighted the QBank, and then now we're in the self-paced lessons all the way to the left. We'll go over what these other tabs are in just a moment. But the course index within the self-paced dashboard really offers all of the lesson content in drills and by subjects and subtopics, and it's really easy to navigate. So just kind of thinking about how this might be used within an academic or a professional development setting. Really, as a nurse educator, I see this course and I say, wow, this entire course could be assigned through a senior seminar. It could really be mapped out in a course calendar with specified due dates, having learners go through each client need category. Really, the same could be done in a professional development setting, such as a nurse residency program, if you're hiring graduate nurses, or maybe a program that employs nurse interns and has an agreement of retention upon graduation. This would be a really great product for NCLEX prep for success. So let's take a look at the first client need category, which is our management of care, that lesson 1. So we can go ahead and go to the next slide. I just sort of wanted everyone to be able to see what this looks like from the inside. And it's really well done, very bright colors, just very well organized. So again, this is formerly known as the NCSBN's Learning Extension. And so we're taking that deeper dive into each client need category. So The self-paced lesson is going to offer a comprehensive review and step-by-step learning within each client need category. The course itself contains over 1,000 slides and study notes from the NCSBN, which is really very valuable. The other things that it includes, and I'll go to the next slide in just a moment and show you some of these items, is a pre-assessment quiz for learners, animated video lessons. There are knowledge checks, reflective scenarios, as well as obviously we can see images and graphics to further explain challenging concepts, and then a post-lesson practice test. We can go to the next slide. So I just pulled some examples of a knowledge check to the left, and you can see it's just very easy to read, easy to know exactly what to do with it. And then on the right, a reflective scenario that is a learning activity within this module. So as I was looking through this content, and I'm thinking of how would I implement this in an academic setting or a professional development setting, this could be used, again, in a senior seminar course, prepping them for graduation, for NCLEX, or also professional development. But really, I see these learning scenarios as engaged learning activities that we could really use in the classroom. And students could share their answers. You could potentially assign this as group work and have them actually complete it in a live environment in our face-to-face courses. So there's really a lot within this. I know it's a self-paced and it absolutely can be used in that way, but I just see a lot of opportunity for this to be used in the classroom if that's something that you would choose to do for NCLEX prep. We can go to the next slide. So our QBank, again, is included within the self-paced course. So I'm not going to go back through everything within the QBank, but I just wanted to circle, and you can see below all of the client need categories that it does include. And these are separated by drills, just like we saw within the QBank. And this, again, will give them that score report so they know exactly where their areas of improvement are, and they have the ability to go back and remediate if needed. These can also be uploaded so that you could keep an evaluative measure of how they're doing and really track their progress as well as an educator. We can go to the next slide. So as we're looking at, I just pulled one of the client need categories. We won't go through all of them, but basic care and comfort, we'll just go into one of the drills. And so we can go to the next slide. I just wanted to give a visual example of what this looks like within the drill. So this is question 9 of 20 within this question set. You can see this is a first generation multiple choice question, but the format is well laid out. The learner knows exactly what to do. They're able to advance to the next set of questions, or excuse me, the next question, and then obtain a score report out of that set of questions. We can go to the next slide. So I'll skip over the other client need categories because I really want to spend some time to, spend some time on the NGN items. There, again, are over 200 NGN items, and all of the NGN item types that are currently on the NGN NCLEX that launched in April are within our drills. We can go to the next slide. So I won't spend a lot of time because we have all educators and leadership on the call going into each different type, but I want to give some examples and then just give this list here as well, that our QBank does hold all the different types of NGN items within the case study. NGN items and also the standalone NGN items. So we're going to take a look at some of these items within these screenshots that we'll go through. We can go to the next slide and go into the NGN Drill 1. So these are questions that I just pulled from the NGN Drill 1, and you can see it's well laid out. We can see that this is extended multiple response item. Just to give a quick explanation of this item, these extended multiple response items, they allow candidates to select one or more answer option at a time. So this item is really similar to the first generation NCLEX multiple response items, but there are more items that they can select, and they also use partial credit scoring. So this is essentially like the previous select all that apply, except for what's different now, as we can see on the left, there are case studies for the participant to go through. And so you can see these are all tabbed out really nicely. They can go through history and physical, their progress note, flow sheet, medications, and any diagnostic results. They can obtain that information about the patient and then try to make their best clinical judgment decision for what the question is asking. So that is an example of an extended multiple response within our NGN Drill 1. We can go to the next slide. So this is an example of a standalone item. This is our standalone bow tie. This is how it looks. So just for reference, the bow tie is testing 3 different parts of the patient plan of care. And what the candidate will do with this is they will have the data to the left, and we can see that history and physical, progress note, flow sheet, and then they'll read that information and have to determine the actions that they're going to take for this client, what the potential condition might be, and then the parameters to monitor. So they'll drag and drop their answer choices from below up top. And so these were all, again, created by current nurse educators who are teaching, who are in the clinical setting, who hold certifications in specialty areas, and who are able to write to activity statements within that NCLEX framework test plan for each client need category to make this as real and relevant as possible and really aligning with the NCLEX test plan. So that's an example of a bow tie. We can go to the next question. I have 2 more examples. This is our matrix grid. So this is what this type of question would look like within our NGN drill 1. And so for this question, this allows candidates to select 1 or more answer options for each row or column. This item can be really useful in measuring multiple aspects of the clinical scenario within a single item. So this will be built into a case study. In this example, candidates would read the data and then have to determine what findings are reportable to the provider or which ones are anticipated. And so this is just an example of how that's laid out and how those questions look within the drill. We can go to the next slide. So this is the last one that I pulled just as an example, so we could all see what it looks like within the test bank. This is an example of an extended drag and drop. And so this is what the candidate would see. They'll read the data, they'll move the assessments over to where they need to go. And so this item type is like the previous NCLEX ordered response, but not all of the responses may be required to answer the items. So they may not pull over all of them. And that's what this would look like for a drag and drop, extended drag and drop. We can go to the next slide. So as you can see, we have, I didn't pull every single NGN item type, but they are all there and there are over 200 of them. Another feature within the self-paced course is the practice exams. And so I won't go into detail about this again, but everything that we discussed within the QBank, those 2 practice exams, the practice A, practice B, 145 questions, 15 of them are NGN items. Those are all here as well. So that is all included within the self-paced course. And again, I just really think that this could be utilized within a senior seminar course or within a professional development setting and be able to have this score report uploaded so that we could track and trend and see how our students are doing and where they may need coaching, where they may need additional tutoring or mentorship to be able to be successful in all of the client need categories they're being asked to be for NCLEX. We can go to the next slide. So our LiveOnline is the last product that I wanted to cover today, and sort of this is everything all included. When we go to the next slide in just a moment, you'll see a list, and I'll go through it of everything that's included. But what I want to mention before we get there is the QBank and the self-paced course, or the self-paced course because it includes the QBank, is a really great preparation for the LiveOnline. So if this is something that you would assign to a student, to an employee, the self-paced course is something that they would want to foundationally be able to go through and have just some experience with the questions, with the material, be able to remediate a bit before they come to this LiveOnline course, so that they're able to come with questions and to dig deeper into these client need categories for the content that's presented. We can go to the next slide. So the LiveOnline course essentially is 18 hours of expert online live instruction with a nurse educator. 365-day access to all of the content. Another nice feature of the LiveOnline is that students or employees are able to contact their instructor one-on-one via email, and they also have Q&A access. So if they are struggling with a concept, they're able to take that outside of the course, and we'll talk about the different courses in just a moment, to be able to have that broken down and get their questions answered so we can make sure that they are understanding the content and that they have clarity as they move forward. They have access within the LiveOnline to the entire self-paced course and the entire QBank. So this is sort of everything in one that is just a large package. It also includes the practice exams A and B, which we've already discussed, and additional practice drills a la carte by client need category, which were within the QBank. This also includes the flashcards as well. This LiveOnline launched in the fall of 2022, so we're almost at about a year of this being live, and we have received a lot of positive feedback. I know a lot of questions probably on the call are, what is the data? What are the pass rates? Because this is such a new product, we are collecting that psychometric data, but we do not have data to report yet, but hopefully in the near future. We can go to the next slide. So I just want to highlight that our LiveOnline courses are with an RN instructor. And so these RN instructors are top level teaching, have top level teaching credentials. All of our instructors have an active RN license, as well as our content development team. They all have at least a master's in nursing education. They have at least 10 years of teaching experience with at least 5 years of practice experience. They also all hold a certified nurse educator certification, the CNE. So they're well prepared. They are passionate about teaching. They want to invest in the next generation of nurses and really make sure that our candidates are successful as they are preparing for the NCLEX Next Generation. We can go to the next slide. So just sort of a breakdown of the classes. There are 6 sessions. So in total, again, it's 18 hours. So there are 6 sessions with 3 hours per session with a live nurse educator. So I've got the classes listed here, class 1 through 6. You can see candidates will go through the fundamentals of nursing. They'll go through adult med surg 1 and 2, as well as pediatric and maternal newborn nursing, the pharmacological and parenteral therapies, and management of care. So really, this LiveOnline is an opportunity for candidates or students to have this time with a nurse educator instructing the course to take a deeper dive into the content areas. And so by taking a deeper dive, meaning some of the there is content that we all know and we teach that is just a struggle for students. It is hard for them to understand. So an example in pediatrics, could be something like growth and development. Sometimes that can be really complex and really hard to retain and understand and apply. This is broken down within this course. Within the med surg courses, concepts like rhythm analysis and mechanical ventilation, those are concepts that can be hard to understand for students. And so it's really allowing the student to have that time with a live instructor to ask questions. And also it creates time for them to follow up with Q&A or that one-on-one email support that they receive as well. So additionally, I just want to mention that our instructors, as I previously mentioned, are experienced educators and clinicians. And really, I think that the difference here is that because they are so experienced and they currently are teaching in the classroom, they're currently in the clinical setting, they're able to take that classroom knowledge that we all know that our students have and translate it into clinical judgment. Because as we know, the NCLEX Next Generation is not asking students to retain knowledge and give it back, right? It's asking them to make decisions for their patients. And so this is something that can really be broken down and help to understand that clinical judgment model that the NCSBN has showed all of us that really is going to drive the future practice of nursing. So it's really exciting. And I think that these products are really a way that we can come alongside students and help further best prepare them for the exam ahead. We can go to the next slide. So finally, this is our satisfaction guarantee. The Princeton Review satisfaction guarantee is that if a student is not satisfied with any of the courses, they can extend their time within the course, which is really nice. So this is an institutional course guarantee, and I think Natasha could speak a little bit more into this, but we did want to, of course, mention this throughout the program or at the end of the program. We can go to the next slide. All right, so we are at a time of questions. So if anyone has any questions, I believe we want you to put them in the Q&A, and then Natasha and I will go through and help answer.
Thank you so much, Jennifer, for taking us through our 3 programs. We are at 3:30, so we do have 15 minutes for any questions. Okay, we just received our first question from Stacy. Our current partnership we have for institutional programs, we will actually partner with that institution. And so you could choose through each separate program which is the best fit, whether it's the QBank, the Self-Paced, or the LiveOnline course. For the QBank, you will have access to the QBank for 90 days, and that will be $99 per student. The Self-Paced program is going to have access for 1 year, and that's $250 per student. And then the NCLEX-RN LiveOnline course, we're currently pricing for $7,500 per course, with up to 30 students registered within the course. And so when we partner with an institution or a hospital, we're going to be contracted with that institution or hospital for a year. So you're locked into those prices for a year. And then if at the end of that program, if your student does not pass, we will again extend that online dashboard content for free of charge for an additional year. And at the end of this, after we complete the session, I will be following up via email just to review the costs and to answer any other outstanding questions that you may have had from the presentation. Okay, any other questions? I don't have any other questions that had come in except for the pricing model. Right now, all of the contracts that I currently have with institutions, or we do have a contract with 2 different hospital systems, are our QBanks. They've worked out really well for all institutions, and they have seen great pass rates from all of their students and are renewing with us again this year. The hospital systems that we are partnered with, a lot of this student nurses that come to them, they don't end up passing the NCLEX on the first pass. So even though they come from an institution that had offered them some sort of preparation, they're unfortunately not passing. And so then the hospital is purchasing on behalf of those students our NCLEX QBank. And then from that point, student nurses are passing from that point. And then they have sort of a sign-on bonus incentive for those nurses as well. And then also at the hospital level, that they have been providing that to their LPNs, who then want to elevate to RN, and then providing that as some professional development. So there's a lot of different ways that you could utilize these programs, but they are extremely helpful, and we are definitely seeing the results that students need. And that's the most important part. Any other questions? Jennifer, in the interim of waiting for questions, anything else that you'd like to add?
I don't think so at this time. I think that, just as a nurse educator and thinking about the academic side and thinking about the professional development side, and even being in situations where I've had, students who come to the organization and they have not passed their NCLEX, the support that this program could provide, I think is just a great kind of plug and play. So they're able to have access to this quickly. It's something that you could certainly follow up on, and you could also just create within your learning management system a place for them just to create accountability and make sure that they are on track for that NCLEX prep for the next time that they take their exam, if that's the case.
Okay, any last questions? So at the end, within 24 hours, you will each be receiving a recording of the webinar. And so feel free to pass that on to any colleagues. I will be following up via email, and I will certainly include that answer about scoring within my email follow-up. So be sure to look for that. Well, thank all of you for attending. I really appreciate you taking the time, and feel free to reach out in the interim. Thank you so much, Jennifer. I really appreciate you taking the time to take us through our 3 programs.
Thank you. Thank you for the opportunity, and thank you to everyone for being on the call today.
Thank you. Have a great day.